Old age, they say, is a blessing. But did you know that men of a certain age are more likely to get prostate cancer? Even further, being of the black race increases this risk. Prostate cancer is the second most common type of cancer that affects men worldwide. This cancer happens in 1 out of 7 men. Men of a certain age should get regular screening checks. The prostate makes some of the essential components of semen. Though this gland is small, this gland is actively involved in reproductive health and can cause voiding and urinary problems as men age, and also be a source of cancer. The good news is that prostate cancer is treatable when discovered early. If you're diagnosed early, it's extremely treatable. Like other types of cancers, prostate cancer happens when cells mutate. These changes in DNA causes these cells to actually grow faster and live longer than they should. This cancer can actually spread to other parts of the body as it keeps mutating. This cancer usually happens in people with male reproductive organs, whether you're trans or you don't identify as male. You can actually get prostate cancer if you have a prostate. Yeah, that's a risk factor. So risk factors for prostate cancer, apart from the first one I mentioned, like that is having a prostate, is age. So screenings are encouraged in older men because they are at higher risk of developing prostate cancer. Another risk factor I want to talk to you about is ethnicity. Black men have higher risk of developing prostate cancer. Also, if you're overweight, you also have a higher risk of developing prostate cancer. Genetics also has a role to play. If you have family history of prostate cancer or certain types of breast cancer in your family, maybe you know someone that had that in your family in the past, you should get regular screenings as a man as you age. So prostate cancer sometimes presents with no symptoms at all, and whenever it presents with symptoms, it means it has gotten to a very bad stage. But these are symptoms that you may notice. The first one you notice is trouble urinating or decreased force upstream. The second symptom you notice is blood in urine or semen. The third symptom you likely notice is bone pain. Bone pain, unexpected weight loss, unexplained fevers. If you have any of these symptoms and you are above 40, I'm not like setting, you are aging, like you are old enough, you should get regular screening checks for prostate CA. Diagnosis can be made through a variety of tests. The first and the most common one is the digital rectal exam. In this particular diagnosis, the doctor inserts his finger into the rectum to feel the prostate to see or to kind of detect if there is any abnormality in the prostate. This is usually accompanied by a blood test. This test actually checks if there is presence of prostate specific antigen in the blood. Both tests usually gives diagnosis for prostate cancer. So in cases where there is any abnormality with the prostate during the digital rectal exam, The next step is usually to figure out how far this has spread to other parts of the body. Fortunately, prostate cancer doesn't spread fast. So this figuring out how far it has spread can be done via different diagnostic methods. You can get like bone scans, CT scans, MRIs, and even specific PET scans to determine how far the cancer has spread. In external beam radiation, high energy beams that deliver photons target and kill abnormal cells in the prostate. This is done from outside the body. Like I said earlier in this video, prostate cancer is extremely curable. It's just that your prognosis are better if it is caught early. Now, if prostate cancer is detected and it is localized to the prostate, that is, it hasn't spread to other parts of the body, surgery can be done to take out the prostate. That's the first treatment method. The second treatment method is by radiation. In external beam radiation, high energy beams that deliver photons target and kill abnormal cells in the prostate. This is done from outside the body. Another treatment method available is chemotherapy. In chemotherapy, powerful chemicals are used to kill the cancer cells. Another treatment method is the cryotherapy. In cryotherapy, the cancer cells are being frozen. So these cells use testosterone for growth. So it is beneficial to block this hormone. So this leads us to the next treatment method, which is the androgen deprivation therapy, ADT, where you block production of this male hormone. But the thing is, these cells still find a way to grow without this hormone. Now, it is worthy to note that all these treatment options, they have their different side effects and they also have their success rates. So discussing with your healthcare provider is the best option you have. Your healthcare provider will give you the option that is best suited for your case. As with other conditions, it is advisable that you join support groups. Support groups are helpful in dealing with stress that comes with being diagnosed with prostate CA. I'm sending you love and light, and I wish you all the best. Do well to stop by next time, and please give me a thumbs up if you like this video.